Welcome back, everyone. Keeping an eye on your world this morning. Stark new data reveals a global surge in violent attacks on healthcare workers. Now, this report, released by a coalition of humanitarian groups, including Chicago's own Medglobal, found that hundreds of healthcare workers have been killed, kidnapped, or arrested while in conflict zones in 2025 alone. Medglobal calls this an alarming trend and a violation of international law. So joining us live now from one of those conflict zones in Ukraine is Dr. Zaher Sahloul, the president of Medglobal. Thank you so much for being here with us.
Thank you for having me, Marissa.
So I know our signal's a little rocky, so we're going to keep you as long as we can. Doctor, we know that you're in Ukraine training healthcare workers who are at risk right now. Can you talk to us about what that training looks like and what you're seeing on the ground there?
Well, this is my seventh medical mission to Ukraine. We started to send our doctors and volunteers to train Ukrainian physicians 2 weeks after the full-scale Russian invasion. This mission is focused on trauma. I was in the city of Odessa on the Black Sea yesterday, and then I took the train overnight to Kiev. So right now I'm in Kiev. We have 5 surgeons from the United States and New Zealand who are training about 40 surgeons in Odessa on how to deal with the impact of this war on, of course, civilians and patients. And what we're seeing, in particular in Ukraine, that drones are causing most of the injuries and death in the battlefield and also on civilians. 80% of the injuries and death in the battlefield are related to drone-related injuries. We're seeing also the same pattern, of course, in the recent war in Iran and the Gulf states. So this is a very alarming trend because people and healthcare workers are not familiar with this kind of trauma. It's usually cause more contamination, late evacuation, more amputations, and also a rise of resistant bacteria that will not only affect the Ukrainian patients, but also it can spread to other countries because bacteria have no borders.
It's interesting to learn about the impact of those drones. I want to ask you now about that report, more about that report, because it says when a hospital gets hit, everything in the system is impacted, as you mentioned this, from supply chains and to mental health. So how does that impact the people that you're seeing, that you're trying to treat?
Of course, this is another alarming trend that we are seeing in the recent conflicts. And unfortunately, we are witnessing more than 60+ conflicts in the world nowadays, the worst since World War II. We've seen these attacks on healthcare in Syria, then we've seen it in other countries like Gaza and Ukraine and Sudan. According to the WHO, more than 3,000 attacks on healthcare were counted in Ukraine until now. And when a hospital is targeted, that means there's no place is safe. Hospitals, schools should be safe places. When hospital is bombed or attacked, that means you are depriving the local population from access to health care. And it's very difficult to rebuild the hospital and reestablish the network, even after the war stops. So it's against international humanitarian law, and unfortunately, we are seeing this happening over and over.
Yeah, okay. Dr. Zaher Sahloul, thank you so much for sharing a little bit about this new report with us. Stay safe.